Caravan's all about we putting together for essential workers. I mean, they're out there on the front lines. They don't have the option of staying home and on lockdown. And truthfully, the healthcare workers are really right there taking care of these folks. I mean, they come in with COVID. I mean, they're the ones dealing with the ones that are sick, the ones on the ventilators. I mean, and it's not just the COVID and everything at work and that scare. I mean, they have to there's issues with childcare. If their child care provider is not taking the children, how do they do that? How do they, if they're out of work, certain days, how are they paying for that? There's just a laundry list of other, real life issues that they're dealing with as well. And we just got to show our appreciation for them, being there for us, so we want to be here for them and just show them that we appreciate it. Because, everything they're doing is just, it's amazing. Because, it's not, you signed up to be this and you, a healthcare worker and it's going to have those times where, you might be taking care of an isolation patient or something, but this is just, one of those black swans and it just hits and it's everywhere. And this, a lot of people, I'm sure, especially in healthcare, is like, this is what I signed up for, but they're stepping up. And it's, incredible what they're doing.
There's been quite an outpouring of support from the community, thanking them for what they've been doing. When they see events like this, when they see care events like this, what does it mean to the workers?
Oh, they appreciate it. Just knowing that we're planning this, the feedback that we're getting, when I was trying to make sure that I had the clearance with the hospital, the management administration, Michelle LeBeau was like, no, I support it, and I thank you for it. Because, we're thanking them too, because this is just, things even back in March were just changing hourly, and just to try to deal with that. And, I think, the hospital, the healthcare workers here have really stood up. The union, is, don't want to say, but is just stronger for it. That structure that's built and to take care of our folks so they can take care of the patients is, like I say, it's better. And they appreciate it so much. You hear it because just every little thing that you can do. Even if it's just the smallest thing, it's going to be appreciated because they need that in the day. Because that's what the stress and anxiety normally in healthcare. This is just spinal tap turned up to 11. This is to deal with this. And I could go on all day about how much I appreciate what they're doing and being there, and trying to make sure that they're being taken care of as well. And so
how difficult has it been for them and their families these 9 weeks?
Well, and I deal with it. That's the part of the side that I deal with. A lot of them. It's huge because like I was talking about. Childcare. What do you do with that if you can't come to work? Who's going to be filling in? And I just over the weekend. There's somebody like, look, I can't work the weekend because my childcare provider was exposed. What do I do? And that's the question. Just it's lingering there. It's the unknown. It's day to day because any little thing could happen. It's stressful enough being a healthcare worker on the best days, but to have all this and be dealing with it and stoically dealing with it, most of them, is just, like I say, amazing, incredible. What word? It's kind of, you can't really describe it as far as, because normally they're amazing and incredible. This is just above all that, and you can't really put words to it. I think truthfully, with the gratitude of the community and everybody else, it just.
How many employees are there here?
Overall, I believe it's about 3,000, give or take. I know maybe about 2,500 to 3,000.
2,500, okay. And how many in the union?
In 1199, we have 1,300 members here at the hospital. We cover everybody but the nurses and professionals. Everybody, competent, that. But it's all walks. It's a very dynamic group because we have, nutritional service workers, dietary, CNA, CAs, and then we have techs and, facilities. So to bring them all together, even to agree on one thing is sometimes, really different walks of life. It's, but they do a good job of coming together and sticking it out and supportive of each other, especially through this.